Hi, welcome back to the podcast. I'm Dr. Lindsay Manzullo.
Dr. Christopher Nolikin. We're here today with two very interesting topics. The first topic is blood banking. So we've actually invited some guests from the opposite side, or maybe not the opposite end of the country, but the middle to western part of the country out in Colorado. We have our sister hospital out at Wheat Ridge actually has a blood bank. So we thought we'd invite some team members from there who run the blood bank to give us some information about that. So I think, Lindsay, the thing with veterinary medicine is like stuff magically appears in the fridge, right? Like,
Yeah,
you need blood, right? So an animal's bleeding or it needs some sort of replacement for some component of their blood, and we just like go to the fridge and there it is.
Yeah.
So there is quite a bit of magic behind that, actually. So our team members here, Tricia and Haley, can you guys give yourselves a little bit of a brief intro to the listeners or watchers?
Yeah, I'm Tricia. I am the manager that oversees the blood bank at Wheat Ridge Animal Hospital. I am a technician. Spent a lot of time giving transfusions, and it was just like you said. You open the fridge, there's blood there. You go ahead and give it. You don't really think about where it comes from or how it's processed. And over the years, I kind of started thinking about those things, and that's why I got interested in working in the blood bank and came over to Wheat Ridge to manage that side of things. So that's me.
Excellent. Hey, Haley.
So I'm one of the assistants, or actually the only assistant in blood bank. And it's a really cool area to get to work in. It's a different way to help animals that I really enjoy. And this is my first position in vet medicine, aside from client care, where I'm working more closely with animals. And I worked closely with Tricia and Kendall, our other technician, previously, and I thought, this was a great opportunity to learn more and expand my knowledge. And I just, you don't really think about animals getting blood just like humans. And so when I learned about this, I thought, oh my gosh, how cool is this? I want to learn more about it. I want to be able to help animals in a different way. So that's kind of how I transitioned into blood bank, and I absolutely love it. We develop these great relationships with our donors, so it's awesome.
Mm-hmm. Yeah. So, go ahead.
I was going to say, I think that people, often they think about like human blood banks, and it's something that's very familiar to them. So when we do bring up the concept of animal blood banks, people are like, wow, I can't believe you guys do that as well for your veterinary patients. And we've touched before on a previous podcast about the need for our blood and the fact that blood banks are something that is important for our veterinary patients. But how does your blood bank work at Wheat Ridge? Like, how do you guys have it set up, and how do you specifically, have that run?
Yeah, so we have like a little over 100 donors in our program, and what we do is we'll call them like every week. We're calling donors to get them scheduled, and we usually schedule them between 7 to 8 weeks to donate. And if it's more of an urgent need of blood, we'll call them in at 6 weeks at the earliest. Some donors will call a little bit later depending on the blood type, but they'll come in every scheduled time and do their donations, and they get showered with love and treats and hugs and kisses, all that. And we do provide blood products to other hospitals across the United States as well, definitely the Denver area, but quite often we're selling blood to other hospitals across the nation as well. So we're always in need of new donors joining our program.
So what is the difference? So you get owners to come in and allow their pets to donate. Do you have any donors that live at your hospital, or is it exclusively a community donation?
Our canine program is exclusively a community program. We do have feline donors that live at the hospital. I think that people are a little less wanting to let their cats donate. Cats typically need sedation. So we can monitor the health of the cats, and we can control that a little bit better if we have them in the hospital, and they get great care as well. They're also loved by our staff. We have giant cat rooms with giant windows where they can watch the birds and all that kind of stuff. So they get a lot of attention as well. But the canine program is strictly community.
Mm-hmm.
And how do you if you have a strictly community program, like for these canine patients, if that patient is a suitable donor?
We do have requirements for our donor program. There's a weight requirement of 55 pounds. They also need to be between the years of 1 and 6. We do retire them at the age of 9 as long as they continue to be healthy after the age of 6. And then we also want to make sure they have a friendly disposition. The donors that we bring in, our donors love coming in because they get all the attention, they get all the love, they get all the treats. So we want to make sure that it's a fun experience for them. They usually run in, jump all over Haley and Kendall, and kind of enjoy their time with us. So we want to make sure that they're happy and they're enjoying the process with us.
So most of them you didn't, or all of them, you don't need to sedate the dogs to do it?
We have a few that get a little bit of sedation, but for the most part, no. It's again, we want to make it a positive experience for them, and if we have to go to the lengths of using sedation, we prefer not to. Yeah.
Now, the amount of blood that you guys take for each individual donation, obviously it's going to be dependent on the size of the dog, I would imagine. But then, like with people, how you get a little apple juice and a little cracker afterwards, do you find that your canine patients, they need like a little snack or something afterwards?
Yeah, so we actually feed them. It's just like a very bland, like low GI diet that we'll give them. It's like a whole can that they get. And then during the whole donation process, they're getting a bunch of treats. So they definitely enjoy coming in. And sometimes we have dogs that they might have like some sort of food allergy. So we just have the owners bring their own treats and food, and we'll just give those to them as well. So they definitely get a lot of food while they're here. I think that's why they love us.
Probably.
So what do you do to the blood once you've collected it?
Yeah, so once we've collected it, we take it into the office area, and we have a super big centrifuge in there, and we will place those in there and spin them down, which will separate the blood from the plasma. And then once those are separated, I will put it in, it's like a squeeze chute. And then depending on, I'll know ahead of time if we need to get a double unit or a single unit. And then the squeeze chute is going to squeeze the plasma out into the satellite bag. And then again, I'll know where to stop it and everything depending on the weight. And once that's in there, I will clamp off the lines, not cut them off yet, but then I'm just trying to get the air bubbles out of the plasma, and then I'm mixing the blood bag. And then once I've done all that and gotten all the air out of both bags, I come next door and I'll recheck their red blood cell volume, so their PCV. And as long as that's in the range of what we're normally shooting for, then I can go ahead and come back and cut off the lines and tie them, and we put labels. And then we actually have we take pictures of our donors every time that they come in, and we put their picture on the bag. That way, when a dog does get a transfusion, they can see who the blood is coming from. And if they would like, they can send in a thank you card to the donor as well, which is really special.
Oh, I like that idea.
So sweet.
That's super good.
Yeah.
So would you say, I know you were mentioning that you do send them out to other hospitals across the country. Does it tend to be sort of within your geographical location, or you really have a vast, spread of sort of hospitals across the U.S. that you're supplying?
I think the furthest that we've sent blood is probably Tennessee.
Okay.
Yeah.
Do you agree, Haley?
So.
Yeah. We actually, my predecessor in the blood bank, she actually did a lot of research on the packaging and all that kind of stuff to make sure that we're shipping things appropriately. So we have these special containers that we use to ship, so we can make sure that the blood maintains its right temperature. And then we also, for the plasma, we use dry ice to do the shipping, so it stays frozen. So.
I think that's the biggest important thing that perhaps a lot of owners don't realize, is that not only do you use the blood on patients, but also it only has so long that it lasts, right? Yeah. So red blood cells, you cannot freeze them. You can't you have to just refrigerate them, and they will last a month in our fridges. Do you have any other, I guess fresh frozen plasma is the other part of the blood, and that will last a year in the freezer. Once you thaw it, you have to use it right away. And then it can be downgraded to what's just called frozen plasma, because after that 1 year of expiration, it just lacks certain factors. I would have to refresh myself. Perhaps you know what those things are. But yeah, so we have to continuously, like, sometimes we have to throw it out. You know, it really is terrible, but we, you know, try to purchase just enough blood so that we will use it in the amount of time that before it expires.
Yeah.
Yeah. So you guys also, you screen for blood types just like in humans. Can you give us just a little brief blurby about the different blood types in dogs and cats?
Yeah, I think right now in dogs, last I knew they've identified about over a dozen different blood type groups. But the one that we're most concerned with here, and the one that's most documented in blood banks anyway, it's called the DEA, or dog erythrocyte antigen, 1 positive or negative. The reason why that one's the most important is because it has the most potential to cause adverse reactions in dogs. So the negative dogs are the dogs that can more often, the dog blood that can more often be used in other dogs without as much concern, because they don't have the antigen that can cause those problems, or could potentially cause those problems, I should say. So that's the type that we try and recruit most often, but it seems like the positive dogs are probably more prevalent in the world. So
you do take donations from the positives too?
We do. So, we've also spoken with a lot of our hospitals that do purchase blood from us and tried to encourage them to do more typing on their end, on the recipient, so that they can use more type-specific blood because of the shortage of product that's available. So.
Yeah, that's from the clinical standpoint. You're always right. You have an animal in front of you, right, and you have an owner attached to it, and there's money and there's everything involved. So the ER doctor's tendency is to just grab the blood that they know they can give, the DEA 1.1 negative.
Right.
If a dog has not had a transfusion before, you can safely administer that, right? But then every time after that, if you've given it the wrong, any sort of blood transfusion, it could have developed antibodies against it, and you have to be more careful and do these, typing and cross matching. But if we could just type them first, then we could use the more common but less useful blood that is the positive, and reserve that universal donor blood, right?
Yeah.
We try to teach our ER doctors.
And the cats are a little bit easier, I guess, in some ways, just because even though cats still have different blood types, the vast majority of them are one particular blood type. And so it makes it a little bit easier sometimes.
I don't know, Lindsay, out there on the West Coast.
Oh, that's true. Actually,
yeah, if you asked our doctors at the Hawaii hospital, they would probably tell you they see a lot of big cats.
Wow. Yeah.
Yeah. So it is definitely by geographic. Yeah. So yeah, it's very interesting how it plays out that way. So.
Yeah. So a cat is born with the antibodies to react against the opposite type of blood. So if you have to type every cat. Or else you can kill that cat if you give it the wrong type. And we were saying, fortunately, there's A and B. There's also AB.
AB, yeah.
But that I don't think I've ever seen. But so the B cats here on the East Coast, it's maybe 1% of the cat population.
Well, it's more like the exotic type of breed.
Yeah.
But I guess, in Hawaii, maybe they have the bees over there. That's cool.
And we actually have been lucky enough to find some bee cats and have them in our colony, and they're actually just domestic short hairs. So
really?
It's been, it's been really interesting to see more and more of those. And
So like our hospital group on the East Coast keeps 1 or 2 units of bee blood in the fridge at all times. And honestly, sadly, most of the time that blood expires, but every 6 months or so, we have a BCAT that we need, and we can call up that hospital and say, we need your unit, and we can get it. So that, otherwise it would be a multi-day delay to get that blood, and that might be too long. Yeah.
Well, that's I think it's quite fascinating to feel to know that you guys sort of have your own blood bank, though. That is such a great initiative to sort of take on and to be able to provide that for your patients within the hospital. I'm sure all of your doctors love the fact that they have a blood bank in-house. That would be just such a wonderful resource.
Yeah, the critical lists are very fun.
Yeah, right. I sort of wish I had a cat colony that I could go and love up when I was feeling stressed too. I imagine that might be another source of de-stressing at your hospital.
Yes, it comes in very handy for that. You always catch doctors in there doing their notes, calling clients on their phones, technicians just like chilling out with the cats and getting love, because you go in there and they just climb all over you. And
we had a colony at vet school, and those colony cats were the best treated animals around. They were just spoiled by everybody, and it was a wonderful place to go in there, do your note study, and the cats would just totally love it. So
definitely.
Yeah. So thank you guys so much for joining us. It's just amazing. I think you're the only hospital in our network that has a blood bank, and it's really fascinating to hear, everything that you do to keep the blood supply in your region going. We definitely could not be without our blood bank.
No, and it's exciting to also know that you're part of Ethos, just in the just a few states over. So it's kind of cool to have you guys on the show and meet you and have you guys discuss this very cool topic.
Thank you. Yeah, we enjoy what we do, and I enjoy the aspect of having this impact on the entire veterinary community and be able to reach out, even if it's not a pet in our hospital, to be able to help one across the country is just as amazing to me. So I enjoy it a lot.
Yeah, it's pretty great. I'm very grateful to work in this department specifically, but our donors, we really get attached to them. They mean the world to us. So it's very special. We love it a lot.
Excellent.
Well, thank you so much.
Yeah. So then our next section is about fear-free, which is a really exciting thing. It's something that our entire company has decided to jump in on. Lindsay, have you done any of those little
I'm
educational?
Fear-free. I have yet to start doing some of the modules, but yeah, I think that just today's segment sort of made me it was a kickstart for me to get on and start doing it.
Yeah. No, I've done 2 of the segments so far. I mean, they're dense, they're not, you have to sit and really watch it compared to some of the other CE that you can kind of just listen to. But it's definitely very interesting. It's something I'm very excited to get started with. Yeah. So we have also from Wheat Ridge, Brooke Duran, can you introduce yourself, Brooke?
Sure. I am one of the hospital services managers here at Wheat Ridge Animal Hospital in Colorado. And I am also a certified technician. I split managing the clinical departments with the person who preceded me on PAWEDcast, Tricia Keohana. I always mispronounce her name. So I won't list all of my teams, but all of the specialties and GP kind of fall under me, with the exception of blood bank, ER, ICU, surgery, and patient care. She does those. So every other ology is under my realm.
Yeah. And Wheat Ridge is very much a sister hospital for us, because they are the only other hospital within our network that does have that interesting combination of services that does include GP. We both have physical therapy departments. So they do very much what we do. And fear-free is something that our entire hospital group, the entire Ethos network, has started to jump on. And I think Wheat Ridge is really far ahead in that, having started a lot of that before even the entire company did.
Yeah, we did. We were very lucky to have a corporate sponsor come in and help us with getting everyone paid and going through the training to be fear-free certified. So one of the interesting things that came up is a lot of the general practices are getting certified in fear-free. And we said, how do we extend this to include all of our specialists, because you have to have a certain percentage of people to be a fear-free certified hospital, which is something we're very close to accomplishing. We're not quite there yet. So at this time, the majority of our team members are fear-free certified and have renewed their certification, which means that essentially they've just taken a series of courses, I think in total 4 hours, and educating them on the why behind moving toward fear-free, kind of giving them the anthropomorphic insight to the animal perspective that they might not have thought of before, and then how to execute minor things and major things that can make your hospital more fear-free oriented, which can have a really profound impact on the pet's experience and subsequently the client's experience. So the takeaway is twofold, which is really, really impactful.
Yeah, I mean, in fear-free in general, I feel like everybody or all clients would sort of assume that, going to the veterinary office, it should be fear-free. But in reality, it can be quite an a very scary event for these pets. And the fear-free concept really came out, not too long ago. I think it was like 2016. This was sort of started as an initiative to get veterinarians, technicians, receptionists, client care workers to get their certification in the fear-free to really help promote this better experience, if you will, for the veterinary patient.
Yeah.
So tell us about just the general idea of the fear-free program. What does it mean if someone goes to a hospital and there's a little sticker on the window that says fear-free certified, or they go and they search online and find a fear-free practitioner?
Sure. I think the crux of that would be that we are constantly in a self-aware mindset of what is the animal experiencing as they come in for these procedures, because there's rarely an occasion where they come in and there's not a needle involved. There are strangers, and one of the main components is understanding the differences in their biophysiology and how fear is triggered in them than from humans. So what it means for us is we've looked at what do cats need, what do dogs need. So, for example, the sense of smell in animals we know is exponentially more sensitive than in humans. So having a lingering smell of a certain chemical, or even of a dog, different pheromones that are involved, can have a really, really significant effect on the animal's experience. So fear-free is, we have tried to modify not only our environment, including just the sound, so incorporating all of the sensory options there. So auditory, are there barking dogs in the background where the cats are sitting? Was there a dog in the room before the cat enters? So we're basically proactively trying to preempt those negative experiences. And so our hospital, being fear-free thus far, is we have separated where dogs and cats go. We've tried to give cats a higher elevation of where they can be when they're here hospitalized, so they have that comfort of being up high, which is something that they naturally need if they were to be out in the wild fending for themselves. It also takes into account just the fact that we're strangers, and we're also comfortable with animals. We think, oh my gosh, it's a cute golden retriever puppy and everyone wants to touch and pet it. But if you kind of turn the lens around and look through the golden's eyes, there are 20 hands of strangers coming towards them. So to me, it's just a matter of shifting the perspective, and it aligns with the positive psychology that's been kind of changing over human medicine the past couple of decades too. And this is a little bit of an offshoot of that, and it's positive affirmation, just having the setting preset where you're mitigating the fearful experiences, keeping the staff members constantly aware of, fear is a huge component in visiting here, and giving the staff members the tools to counteract that fear. So that's sort of the overall sense of it. And if you were to sum it up, if I had to sum it up in one phrase, it's making this as much of a positive experience for your pet as it can be, despite the fact that we need diagnostics, we need samples, we need to give vaccines, we need to restrain and do all of these things that are unpleasant. I sort of think of it as analogous to, I took my 7-year-old to the dentist the other day for some extractions of crowded teeth, and same thing, you know, for me, I'm an adult. I'm aware that it's going to be a little bit uncomfortable and painful. They don't really know what they're expecting. So it's, again, just putting yourself in those shoes and having that perspective and modifying what you can do in real time to help make it a better experience.
Mm-hmm. So it's like, it's very clear too that it's a benefit to, for sure, the practice to be able to do. I mean, how many times do we run into cases where we have an aggressive cat or we have an aggressive dog, and we need, like, I need blood work on this animal. And so then you're stuck with either, like, gosh, holding this pet down and muzzling it, and just, it's so stressful. It makes you hot. I mean,
yes, it does.
You know,
yeah.
And it's traumatic for the owners too, although we try to shield them as much as we can from that. You know, it's still the kind of thing that it really benefits. It seems like it benefits everyone.
It does. And I think that's an important facet is, you know, we do still need to remove animals from their owners. A lot of times because my pets, for example, are way more nervous with me than without me. And it's pulling back that curtain and letting owners know what we're doing, what their pet is experiencing, and the measures we're taking to try to make it more comfortable. Because as you said, if you get a fractious cat or any cat, and you know, we need those diagnostics. We need blood, we need urine, whatever it is. Once you start getting into the arena where they're already wound up, their cortisol and their adrenaline is kicking, even having to use chemical sedation, which is a big component of fear-free. And we'll touch on that in a second, because we need to get clients more comfortable with knowing that that's a very safe and effective way of being fear-free. So take away the negative connotation of sedation, you know, and anesthesia, because those are actually positive things. But for us as practitioners, it's also beneficial because it helps us give the best medicine we can, because we're able to get those diagnostics and not say, hey, we're going to have to send you home and you're going to have to come back another day, you know, and we're going to have to sedate quickly or beforehand or something like that.
Yeah. And I think the sedation too, and I know you want to touch on that, but that is a piece that is so important, because often these veterinary patients do really respond to either some sort of oral medication beforehand, or if need be, like a quick injection when they come to the hospital. And it really does help simmer them. And I do feel as though there is sort of this negative connotation that's associated with my pet had to be sedated in order for the exam. That's not necessarily a bad thing all the time. There's some pets and patients that, regardless of any pheromones that we set and different rooms that we can set up for the cats versus dogs, or food rewards that we can give, there's some pets that just will not, you know, relax in a normal setting without some sort of additional help.
Yeah. Yeah, and it is. There's a stigma associated with that still. And I think that also relates to, what does the word fear mean? You know, we say, oh, your dog is being aggressive. Simply explaining your pet is being aggressive because they're afraid. Your pet is not a bad pet. We're recognizing that this is all stemming from fear rather than innate aggression that an animal may have. So educating the clients on our processes and the fear-free movement is one of the reasons we're doing this podcast, right? Because we need to let them know that it's not a stigma to have that. It's not a scarlet letter on your pet to say, all right, your pet needs to be sedated. All of my animals need to be sedated before they come in. And to me, that's great. They're going to get a sedative. They're going to be relaxed. They're never going to have wind up anxiety. Because that's something else too. You know, there's both the biophysiological release of certain stress hormones, but they also have mental anxiety too, which humans, in my very ignorant non-DVM knowledge of this, didn't recognize for many years in the past, and we have over the last couple of decades. So there's the mental component and the physical component, and we're trying to respond to both of those to make it a more pleasant experience, and hopefully a positive one.
Yeah.
Did you find that, as you were rolling this out, did you have, I think one of the anxieties that some doctors have expressed is like, oh gosh, this is going to make it take so much longer to do everything. Did you run into any of that? And what's your take on that?
We did. So we got that, I would say, from 80% of our practitioners, mostly the doctors. And the way that we responded to that is, this is novel ground for all of us. So let's give it a try, be open-minded. And what we have found is working with our anesthesiologist and having some preset sedation protocols, especially using the certain oral medications that the owners can give at home beforehand. It's actually made the appointments faster. It's made the experience shorter for the pets. So we were able to quickly sort of show them that, when you take 2.5 extra minutes to give a sedative injectively, or to take those fear-free maneuvers where instead of scruffing a cat, you're wrapping them up in a towel and spraying with pheromones, it actually ended up, in the data we collected, saving probably 8 minutes per visit. So once we were able to show them that scientific data, they were on board with it. And we also correlated this with less bite incidents. So that was an interesting factor. So we did a report of, pre-fear-free bite reports and post-fear-free bite reports. So there was a definite reduction in there.
That's great. I mean, I don't know about you, Krista, but I feel as though, even though I'm not, since it's relatively new, I'm not fear-free certified yet. For years, I feel like if I look at a super anxious dog when I go into the room, that's just not going to be amenable to a physical exam. I found that I would always go to try to just sedate them beforehand to really try to make the experience better for everybody involved. And whether or not that was, he's really worked up today, I can see it. Let's try this oral medication next time and have you come back in.
Yeah.
Or let's see if we can try a quick injectable and see if that can just simmer them down. And then in the in-between time, you can see another patient while that medication is working. And it really does make for a better experience for everyone. And you get a better exam. You can look at the patient much more thorough. And the owners are feeling, I think, in general, even though at first hearing that word sedation, once they see that pet calm and relaxed, and then they wake up and they're calm and relaxed, it's just a better experience for everybody.
Yeah.
Yeah. I don't know. I never really jumped to sedation very often. And so it's going to be a newer thing for me, but I'm not opposed to it at all. I think I just tend to either get less great of an exam and just try to not push that pet past its limits, or, just kind of do something really quick and get out, and that's not really always the best. I think yesterday I had this dog that was like terrified. And how do you feel like owners? I feel like the majority of owners really would love this. And then occasionally you get those owners that like persist in asking for the thing that this pet is going to freak out about. Yesterday, I could think of this one pet that I was like, it's terrified out of its gourd, but gosh, we got to get its nails done.
Right.
And like, so this owner was not prepped at all for any sedation. I actually sent them home with some sedation and said, the next time, this is what you're going to do ahead of time, because he's terrified. Mm-hmm. And it isn't helping us to do this nail trim each time your pet comes into the hospital. Now we make this the worst experience of its entire life because it's having its nails done.
Yes.
And this thing, this dog is like, we tried our absolute best, but you have to muzzle it and you have to kind of hold it and restrain it. And the owner doesn't see any of that because right now we're doing a lot of curbside stuff. Mm-hmm. But like, do you still have owners that just say like, no, get it done? And do you resist that, or do you just kind of go back to the old way for those pets?
We do have that. And we have been resisting it. And so we've gone in and said, this is too stressful for your patient or for your pet, for the patient. And it's also putting our staff at risk. And so for those two reasons, if you want us to accomplish this service, we're going to need you to agree to take a different approach. And that would usually start with the oral sedation next time. And what we'll do in those scenarios that's been very helpful too is explain that at this point, even the visual of the clippers, the sound of the clippers is such a heightened trigger for this pet. We've got to work 10 times as hard to dial back from that. So we'll say, what we're going to do is basically give them a little bit of a dissociative sedation this time so that we can get the service done. And that the way they don't have any sort of memory of the experience. And then we say, we'll slowly try to titrate that down to less and less each time. And then we can incorporate those rewards, those positive correlations with the service. And we have had success with that and letting them know that, yes, we need to be, a little bit more medically aggressive with the chemical sedation this time. But our hope is that that's not always the case. And our staff is trained to slowly advance to the point where we can do this with just a pill, or we can do it outside, or, whatever's required. And usually if there's some sort of hope that we can get it to a less profound experience, then we're successful. Every once in a while we're not, and we do simply reserve that, we just send that person away and say, we refuse this service because it doesn't align with our fear-free protocol.
Mm-hmm. Mm-hmm. And we're talking about like the super worked up patients right now, the ones that are extremely fearful, but in reality too, we have to also focus on the puppies and kitties when they come in, as best we can, giving that a fear-free experience so they don't sort of get that underlying fear of the veterinarian. So lots of feedings while you're doing vaccinations. A lot of positive reinforcements you can do at a younger age can also kind of help in the long term.
Absolutely. And I think that's key is, especially starting with that blank slate that you have of puppy and kitten to do that. An important note on that, as our dermatologist would be very reluctant if I did not mention this, is in using those positive reinforcements, we do have to be aware of food allergies and the potential repercussions in the GI tract that overtreating may have, which we've seen. So we have different levels of treats involved too. So we have high motivating, sort of the higher fat, higher flavor treats, and the ones that are a little bit less disruptive to their normal diet too, because one of the negatives that might be a latent negative is that you give this dog lots of hot dogs and then they develop severe gastroenteritis later. And I don't know if the dog would correlate that with the visit, but the owner certainly does. And then we've completely, failed in teaching the owner the benefit of fear-free. So there's a lot of little nuances like that the courses teach you that you maybe wouldn't have thought of, right? Because how many owners might call and tell us that that's happening?
Right. Yeah.
20%. So we have to be very aware of that too.
And to find a fear-free clinic, and there's the difference between the fear-free practitioner or somebody that's been registered a technician versus a fear-free clinic, it's actually pretty easy. Like I actually went online today just to see if I could find it. And, the website actually is very, easy to navigate, and you can just type a zip code in. You're looking for a practice within like a whatever mile radius, and it tells you everybody that's been certified. So they do a really good job at sort of keeping track of all that stuff.
Yeah, they do. Yeah.
So fear-free, we touched upon this a little bit, fear-free practitioner or technician versus a fear-free practice. There are pretty stringent requirements associated with becoming a fear-free practice. Can you touch upon that?
Yes. I think the big difference comes down to, you can have a practitioner or technician who's fear-free certified and knows how to do all of the things we've mentioned before now of making it a positive experience. The hospital itself being fear-free comes down to a certain percentage of those practitioners being certified. So regardless of who you're encountering, especially in a multidiscipline practice as we have with ER and general practice and other specialties, you don't know what service they're going to come in on. So to say that we're a fear-free hospital means that you might be dealing with a fear-free certified technician and doctor on your general practice visit. But when you come in through ER or see a specialist, you also are guaranteed to have that same experience and certification. And the larger picture of a fear-free certified hospital to me is the environment, the physical environment set up to accommodate the fear-free parameters, which involves separate physical space and keeping those olfactory stimuli completely mitigated as much as you can between dogs and cats. And one of the analogies I use with clients is I have this purple rug in my daughter's room that my beagle has urinated on a couple times, and I washed it on the sanitation cycle in my washing machine, and she still goes and pees on that exact same spot. And the reason is because she can still smell the urine in there even after I smell it. To me, it smells great. It smells fresh, clean. Like the detergent that I used or whatever. And so having the physical space to separate that out and being stringent on, this is truly a cat ward. No dogs allowed in here ever. Well, what about for 15 minutes? No, because the cats, when they come in, they will still smell that there was a dog in there, and that can trigger a prey predator fear response in them. So a lot of what we still need to do here is make a few modifications to the physical hospital itself.
So, one thing that I wanted to direct owners to go take a look at is there is a owner-directed portion of the Fear Free website called Fear Free Happy Homes. Mm-hmm. And that's something that whether or not the hospital that you go to has Fear Free or not, you can still check it out. And they have webinars for clients. They have little videos about training. And it's something that really just provides you with enrichment ideas for even home. It has nothing to do with even being at the veterinary hospital, but your pet might experience fear throughout its life that you're kind of classifying as, being bad or,
yes,
aggressive. And you can definitely start to speak your pet's language a little bit more by kind of looking at those cues. And they have, that is an excellent website.
Yeah. Yeah, I've just glanced at that. I've directed more people to it than I've actually explored it myself.
Yeah, me too.
I've learned a lot of this from working with a certified DBM animal behaviorist, and their focus is all positive reinforcement, right? But that's very key, Krista, because a lot of the fear can be perpetual at home. So they can be in a chronic state of anxiety and fear, and you don't even know about it. And that could be does the cat who gets along with the dog not have a hiding place when the dog gets too crazy, or when you have other people home, things like that? Do they have enrichment if they're indoor animals? Do they get out enough exercise and all that? And pre-vet visit, I believe the learning that you're referencing also discusses this. So the fear can start with little things like when you put the cat carrier out, and when you pick up your keys, and all these tiny things that we do at home that we do routinely, animals pick up on. And so they often, and people will say, my pet knows when we're going to the vet. Well, yes, they actually do, because you go through the same routine and steps every time you take them to the vet. So the anxiety reel begins at home too. And so there's a lot of things owners can do to just make tiny modifications to prevent that as well.
Yeah. Well, that's excellent. So, we are all very much looking forward to doing these courses. We have about a third of our staff, I think, signed up already to do it. Yeah. And it probably will take a long time for us to get the entire hospital certified because, as you said, the rules are, for example, if you're a specialty hospital, you have to have at least 50% of your specialist in that department certified. So if we have a department that has one specialist, that one specialist has to be certified regardless of how busy they are, because they're our only surgeon. Yeah. So we'll see about the entire hospital. We have so many receptionists interested in doing it, and technicians, and that's really key that people are sprinkled throughout the entire hospital and learn these techniques.
Yeah, it's exciting. It's really exciting though. I like it. And I feel like it just sort of is going to enhance that experience, that pet and that owner. And that's exactly what we want to do.
Yeah. Yep.
All right. Well, thank you so much, Brooke, for joining us. And
you're welcome.
So thank you to Ethos, of course, for always sponsoring this podcast.
Sure.
Check us out on any of the podcast listening platforms that you go to. So Google Play or the Apple Podcast Store. Is that right? Yeah. Okay. Rate us and review us. I'm Krista Vernalikin.
I'm Lindsay Renzullo. Thank you so much for joining. We'll see you guys next time.
And Brooke Doran, thanks for including me, ladies. Have a good one.
Thank you so much for coming.
Sure.